I believe that patient education is such a vital component to somebody's recovery from an injury, whether it be treating a sprained ankle or rotator cuff injury or golfer's elbow or even just some knee pain with squatting. I believe the ability to educate the patient and also the patient to be able to educate me on, hey, what are they doing that helps? What are they doing that hurts? Those are things that are really beneficial for that process of healing. If I can't communicate effectively, if they can't communicate effectively to me, there's things that can be lost in translation where we're not really getting down to the root cause of the problem. I ensure that patients understand the treatment plan that we have lined up for them because of one, again, talking about the communication and the patient being able to understand. Yes, we're trying to educate you. Also, we're trying to make you a better athlete. We're trying to help you recover properly. We're trying to help you get back in the CrossFit gym, on the pickleball courts. We're trying to help you get back faster. And being able to understand, here's why this happens with your diagnosis, and here is the proven evidence-based treatment plan that we're implementing with you. Those two things go hand in hand, both with being able to understand the education part of it and the diagnosis and how to get you back even better than before. One of the most common misconceptions I have, at least in our office in our company, is that a chiropractor is just there to rack and crack you and pop you. Many of the therapies that we do with shockwave and dry needling don't involve any type of adjustment. They involve affecting scar tissue. They involve needles, which we're trying to influence circulation and the nerve from a peripheral standpoint. So that really doesn't take into account what a misconception that people have about us, that, oh, we're just here to pop bones back into place. The other component that I like to address is the time that we spend hands-on with people. Typically, our office appointments are anywhere between 20 to 30 minutes. Now, that can be exercise, that can be treatment, that can be adjustments, but it's not just a 5-8 minute in the office, out of the office type of thing. And a lot of our patients really appreciate the time incorporating into their diagnosis and their communication and their treatment plan and how we educate them and what they need to educate us on. All those things are vital roles in some of those misconceptions that some people have about chiropractic care. We encourage our patients to really take an active role in their care plan, in their treatment plan, and in their diagnosis management, because we're trying to get down to the root cause of that. And if they are able to understand, when I'm active, here's what I need to look out for. I'm sure to be active, I need to be an active person, and I need to help the doctor, the chiropractor, be able to say, hey, when I walk 5,000 steps, I start to feel it in my heel. Or well, when I get to 5,000 steps now, after a couple treatments, I don't feel that anymore, and it comes on at 7,500 steps. So those are kind of the markers that we like to have as an active role in their health and wellness, is track some of those things. Give me some data, give me some markers, and that are functional goals for you that give you a better platform for, well, I don't know if I'm getting any better. Well, did you hit 5,000 steps? Did you hit 7,000 steps without pain? Those are things that are big for our company. There's many success stories that we like to share with and how patient education made a significant difference in their recovery. A couple of my patients are runners. They are able to run 8, 10, 12 miles. Some of their success stories involve those distances being able to run without pain. And from their initial injury, when they first presented with me, they were saying, hey, I can barely run a mile without the outside of my knee hurting. Or I start to run and my back starts to hurt and things start tingling down my leg. Being able to judge those things from those previous markers, if it's a time, if it's a mileage, if it's a step count, those things really help make a significant difference in their recovery, because they understood that, hey, listen, here's what I'm trying to accomplish with you. We're trying to get you back up to that higher mileage. You have to understand that I do want to see some improvement with, oh, I felt it at 5 miles, or now I feel it at 8 miles, and now I only feel it at 10 miles. Being able to scale that and help that healing process, educating the patient on that and having them communicate with me properly is really everything it should be in a doctor and client relationship, with the time that we have together, and also being able to say, hey, listen, we need to keep working at this because we know what's working. Let's see if we can we can push the envelope a little bit more.